Have you ever wondered, what if, in a blink of an eye, you were unable to move a part of your body? Paralysis, a seemingly sudden and drastic alteration of life, is not as uncommon as one might think. It's a condition where there's a loss of muscle function in a part of your body, often accompanied by a loss of sensation and control. So what causes this life-altering condition? Paralysis can be brought on by a variety of factors. Stroke, for instance, can cause paralysis by blocking or rupturing blood vessels in the brain, leading to a lack of blood supply. Spinal cord injuries, whether from accidents or trauma, can also result in paralysis by damaging the communication pathways between the brain and muscles. Nerve diseases, such as multiple sclerosis, Guillain-Barré syndrome, or peripheral neuropathy, can disrupt nerve function and lead to paralysis. Trauma or severe injuries, particularly those involving the head or spine, can also trigger paralysis. Infections that affect the spinal cord or brain can cause paralysis, as can the growth of tumors in these areas. Neurodegenerative diseases like ALS, which lead to progressive muscle weakness, and autoimmune disorders, where the body's own immune system attacks its tissues, can also induce paralysis. But paralysis isn't a life sentence without hope. There are numerous treatments available depending on the underlying cause. These range from physical and occupational therapy, which work to improve muscle strength, flexibility, coordination, and daily activity skills, to medications that manage symptoms or address the underlying condition. In some cases, surgery may be necessary to relieve pressure on nerves or repair damaged tissues. Assistive devices like wheelchairs and braces can aid mobility and independence, while techniques like functional electrical stimulation can stimulate muscles and improve function. For those whose speech or swallowing is affected by paralysis, speech therapy is an option, and comprehensive rehabilitation programs combine various therapies to improve overall function and quality of life. The journey with paralysis is undoubtedly challenging, but it's important to remember that each person's experience is unique. The effectiveness of treatment varies depending on the specific cause and extent of paralysis, and individualized care plans are developed based on a thorough assessment of the person's condition. Despite the difficulties, there is always hope for improvement and adaptation in the face of paralysis. In summary, paralysis can be brought on by a variety of factors, including stroke, spinal cord injury, nerve diseases, trauma, or severe injuries, infections, tumors, neurodegenerative diseases, and autoimmune disorders. However, with a range of treatments available, from physical and occupational therapy to medications, surgery, assistive devices, electrical stimulation, speech therapy, and comprehensive rehabilitation programs, there is hope for those living with paralysis.